Welcome back to the Birth Experience, where we're going to be diving into more things birth. We're also going to be talking about advocacy and empowerment today. Today, I am so thrilled to have an incredible guest who has dedicated her life to helping parents reclaim their power in the birth room. Her journey started working with children on the autism spectrum, and she noticed a recurring theme that a lot of these parents were carrying the weight of birth trauma and anxiety. And so fueled by that, she dove into becoming a doula and birth work and educating. And this is just going to be an incredible conversation with HeHe from the Birth Lounge. Good morning, mamas. I am so excited for you guys to be here with us today. I have got HeHe, who is from Tranquility by HeHe, and she is a doula and an amazing birth advocate, and I am so excited. So go ahead and just kind of introduce yourself.
Oh, thanks so much for having me, Trish. Yeah, I'm HeHe. I'm the creator of the Birth Lounge and the host of the Birth Lounge podcast. And I have been in childbirth education for the last 10 years, being a doula at bedside, teaching childbirth education classes, helping dads understand what their role is, and helping people bridge the connection between themselves and their birth goals and their medical team. Because I find a lot of times it can feel like us versus them, but at the end of the day, we're actually on the same team. And so that's what I teach people.
I love that. I love that so much because it should be a team feeling, but a lot of times it's not. And that's kind of what I want to talk about today. So I had a very interesting experience. Last May, one of my doulas on my team was having a baby, and she had asked me to come and be her doula, which I was like, yeah, I actually screamed, right? And so I found out that I did not like being the doula. I am used to having more power in the room.
Yeah.
And so that's kind of why I wanted to talk to you about that, because I knew, oh wait, no, this is not the right thing. Now, I am a 16-year labor and delivery nurse, and her labor nurse was very new. So I was not about to see Ashley go back to the OR for some dumbass reason. So I did speak up, but I wanted to really ask you, like, what does that feel like when because we both know that a lot of stuff happens in the labor room that really shouldn't be happening. So I want to kind of walk through that with you, and I'd love to hear how you've evolved
Yeah.
from when that happened in the beginning.
Yeah, absolutely. Well, I think like anybody, when you first start out with something new, you are really energetic and you just have this like greenness about you, this ripeness where you are kind of unscathed from the system, and you just bring this light of like, oh my gosh, newness. I can definitely say that through the years, I've been doing this since 2016, and seeing that constant trauma has definitely made me hardened in some places, in some regards. It has certainly, I've had waves of bitterness that I've had to work through. And so I think that anyone who's in the birth area, you're going to have these ups and downs because we see so much. I highly recommend therapy. I'm in therapy. I'm a big proponent of therapy. I think everyone in the birth space should be in
Yeah.
therapy. You just, when you're in those really vulnerable and transformational times of other humans' lives, really sensitive places, and places that things can actually go wrong really quickly, and they can go wrong just really, really intensely. You need a support system, and that includes therapy. In terms of, being in the bedside and what that feels like, I mean, for me, I think it comes down to knowing that everybody is responsible for themselves. And so I'm really lucky in regards that when I'm in the birth room with someone, I have worked with that couple for upwards of 6, 7, 8 months. Most of our clients are getting signed up with us by about 8 to 12 weeks pregnant. And so I've had the privilege of getting to know them and knowing their goals and knowing their whys and knowing what's important to them and understanding what they truly do desire out of their birth. I can rest assured that they're not going to be taken advantage of because we've done that work. I can't say the same for someone who is going in and they don't have doula support, right? Or they don't have a partner that has done the work and Maybe they are having your baby with someone who they've never met before because their nurse is just assigned to them that day, and that doctor is the on-call doctor, and they actually are a hospitalist, so they don't even really do clinic work. You've never met this person. That's going to be a different experience. Now, I've seen people I've worked with for months and months be taken advantage of in the birth room, and it crushes me. I mean, I typically not in the birth room. In the birth room, I'm always very professional and I support them no matter what. But when I get home, I cry a lot. It hurts to see the people that you love be taken advantage of, to see the people that you have watched do the work, and see the people that you know what they really want out of their birth, to see that be stripped away and you not be able to, I don't know, almost help them pivot back is really, really hard. Now, a lot of times you do walk away and you go, oh my God, thank God we talked about that in one of our prenatal classes, because they could have very easily said yes to that, or they could have very easily said no to that, and they really needed it. But sometimes, I don't know, sometimes the hospital tactics are just better than you, and you do watch people you love get taken advantage of by the system, and that's tough. That's really hard.
Yeah. And I told you my story that I just got sick because my hands are tied bedside as your nurse unless the patient refuses. Then I can go to bat for you. But the truth of the matter is that, and this is why I started doing what I'm doing, is that when mom's in labor, her really only job is to labor. She shouldn't have to deal with coercion and bulliness and BS, right? So I guess how do you prepare your clients for a situation maybe you didn't cover in the class, but do you have some kind of code like, hey, we need to talk a little more about this? Do you how do you guys prepare for like an unexpected where you know she needs to talk to you a little bit more or have more time? Do you have some kind of process for that?
Yeah, absolutely. So what I teach people, so if they find themselves in a situation where they're like, "Oh my gosh, we didn't talk about this. This is a situation we weren't prepared for." First step always, take a deep breath and remind yourself that this is not an emergency. Because if you are having the time to have a conversation like
It's
this
not
and
an
they're
emergency.
gently bringing things to you, yeah, exactly. Like, then that means you have the time to take a deep breath and evaluate your options. And then you're going to ask questions, right? Maybe that question looks like, can I have 10 minutes to just wrap my head around what you just told me, and we'll be ready to have conversation. Maybe you know the questions. Well, what does this mean for my labor? Well, what are the risks to my baby? Well, are there any risks to me? Is there anything individual to me that you think would make me at a higher risk for this? Do we know why this is happening? There's a million questions you could ask. You may know them already, you may not. I think also relying on the people in the room with you. So you can clear the room and it be just you and your partner. You can also clear the room, it be just you and your partner, and you call just your nurse back in. You just want to hear what your nurse says. It doesn't have to be this big, grandiose community event. Clear the room and then slowly let people in as you filter through them, you know? As far as a code, yes, obviously I'm a very expressive person with my face. So I think it's always probably very clear on my face. If my clients need to ask stuff, I'm usually like, that's not right. Or they
Yeah.
might look at me and I might like give them some eyes of like, you should dig a little bit more here. A code kind of phrase that I teach, and it's not a code because we use it out in the open and it's not a secret, but is there any questions I'm not asking? Are there any questions that I'm not thinking of? Is there anything that I haven't asked that I still need to know to make this decision? If I'm in the room with you, it usually looks like you saying like, HeHe, what should I be asking? And that's kind of code for like, HeHe, what's on your mind? Tell us your opinion. And you know, I'm a very assertive doula. And so if there's a conversation happening and no one has actually addressed me, I will actually speak up. And if you were my client, I would say, Trish, I have a couple thoughts. Are you interested in hearing that? Or, hey, Trish, I have something that hasn't been talked about. Is that something you want to hear? I'm never going to just blurt it out. I'm always going to ask you if you want to hear my opinion. I might say something like, Trish, there's a couple things that haven't been asked yet. Are you interested in hearing what those are, or what's on your mind? And you know, I want to touch on, now I'm kind of going off on a tangent, but
That's
I want to
okay. I
touch on
love
you
tangents.
saying, And this is a good one. You talked about nurses having their hands tied. Doulas, in a sense, have our hands tied as well. So it kind of depends on what kind of doula you want to be. But in my practice and what my team does is we are always very conscious of our relationship with that hospital and those doctors. Now, if we're ever backed into a corner and we have to choose, I want to make sure that we make it very clear I will always choose my clients. So will my doulas. We will always choose them. We work for them. But that doesn't mean that we will choose them at the expense of a doctor or a hospital just because. We're always trying to find that middle ground. We're always trying to, and you shared this when you guest appeared on the Birth Launch podcast, but you said we don't decline stuff just to decline it. Us as well. You talked about too, like baby compromises. So how can we bridge this gap? How can we make this healthcare provider, this doctor, OBGYN, midwife, nurse, feel confident and safe in what we are choosing, but not compromise our goals as to go so far as to give us birth trauma or to change our birth outcomes or to, agree to something that we don't want to agree to? Your doula is navigating that with you. And so a good doula will read the room. If this mom looks like she's holding back and she looks like she has something to say, but she's not able to say it, a good doula will speak up and say, Trish, do you have something that's on your mind? Trish, you don't look like you're 100% confident in this choice. Do you still have questions? Or you still have things you want to talk about? But if that doctor is suggesting something and that mom is 100% on board and she's totally good with it, you definitely, especially if it's a lie, you definitely have room to say, Trish, are you feeling good in this conversation? Are you feeling good with this decision? And if she says yes, in my opinion, then she's good with that. Right? It is not my job to push back on her and say, but Trish, he's lying to you. But Trish, this is dangerous. But Trish, no, you shouldn't be doing that. She just told you she was good with it. She just said that she felt confident. You checked in. She seems respected. She seems like she has said everything. You asked her if she had more questions. She said no. You asked if she wanted to hear what your opinion was. She said no. She felt good. A good doula will let that be.
Yeah, because that could cause trauma.
Oh my God. It's not right. It almost always does cause trauma. That mom almost always walks away saying, well, I was confident until my doula really pushed me, and then she made me feel bad for the decisions I was making. And we never, ever want that. As a doula, that is not your job. Your job is to make sure that no matter what decision is being made, whether you agree or you don't agree, is one that she feels confident in and she feels informed and she feels like she's making the decision. And you personally, you don't have to agree with that. And that is such a pillar in my business. And it's something that my doulas and my team and I uphold in every single birth room. When we walk through that threshold, we're taking off the me and we're putting on the you. This is not about me at all. Well, HeHe, what would you do? I always say, it doesn't matter what I would do, but would you like to hear what some of the data suggest? Would you like to hear what the most up-to-date research says? That may help inform your decision. It doesn't matter what I would choose as HeHe, but it does matter that you have all the information to make that decision confidently.
I love that so much. So on the flip side, do you think there are doulas who struggle with that?
Yeah, absolutely. And look, it's hard. It sucks to be in a room, to see someone making a decision that you have seen be made a million times before, and you literally know where this is headed. You know where we're going. And you're not trying to say this is a mistake, but you are trying to say, are we sure? Are we sure we really want to do this? Are you 100,000% positive that this is what you want to choose? That's a really tough place to be. You need therapy. You need to work through your own stuff. And I say that as somebody who, as a new doula, I had to navigate that. I had to learn, when is it appropriate to speak up? I had to learn, when do I hold my tongue? I had to learn, how do I approach this healthcare provider, this nurse, this doctor, this anesthesiologist? They're the scariest of them all. They are so scary, anesthesiologists are. How do I approach this healthcare professional who may or may not respect my role as a doula in a respectful way, but also that approaches them and lets them know, hey, I'm on your team. We don't necessarily see eye to eye in this moment, but I'm hoping to get get there. I'm hoping to explain to you why I just spoke up in the way that I did and I said what I did. And I want you to know it wasn't a challenge on you. It was just that there was a big gap in care. There was a big gap in information that wasn't being talked about. And I wanted to make sure that we did speak about it before she made that decision, because she deserves to have that information. But it also means that you don't go, well, Dr. Trish is lying. She's clearly a liar. She's obviously trying to cut you open. Her whole goal must be to get home at 5 o'clock so she can go to dinner. That will always taint that. And you don't want
It'll taint your relationship with her too.
you don't want to be that person in her birth memory that did that in her birth. So a better way might be to say, one thing we didn't talk about was the risk of C-section for you and your baby. Are you interested in talking about that at all? Cool. And now she has the opportunity to go, oh, yeah, actually, I didn't even think about that. Or she has the opportunity to go, no, it's a surgery. I mean, I kind of understand what the risks are. Great. She seems so confident in that. Just because you as the doula want to have a conversation doesn't necessarily mean that it's the right conversation to have. And that has to be left up to your client. As the doula, your job is not to 1000% facilitate that conversation. It is just simply to bring space and to bring acknowledgement to that topic. Is this something we want to think about? Is this something we want to discuss? Is this something that we should talk about before you make this decision? And that for me is the fine line of being a good doula and a disruptive doula. And I think that it's very easily to conflate those two and to slip from one way to the other. And you really have to be in control of your own self and your own emotions in the birth room in order to stay in that good doula area and avoid slipping into disruptive doula land.
Yeah. And I love one thing you said is that if she is confident, if she has made that decision, and we know it's wrong, because I've been in the same position. My hands are really tied because I'm employed by these people. But if we start pushing our own agenda, because that's what it is at that point, then we're no better than them.
Yeah. Yeah.
So it really is about what she wants.
Yeah, regardless of how you feel. And I think that's true for all medical professionals, right? And again, we all slip into this. This is not specific to doulas. Nurses can slip into this, midwives, doctors, anesthesiologists, physicians. I mean, all of us are subject to slip down this slippery slope. And sometimes it just takes you go to the bathroom, step out of the room, any excuse to get out of the, I just need a breather, and go check in with yourself. Is this her agenda or is this my agenda? Is this what she wants for her birth or is this what I want for her birth? And those are very different things. What she wants will not leave her with trauma. I promise you, nobody will make a decision that will absolutely give them trauma if they feel informed. If they know all their options, they will make the choice that leaves them with least trauma. You can never make that decision for someone because you just don't know what is going to be traumatic for them and what's not, and they will know every time.
Yeah, and I love because you and I had talked before, and I said like there was one specific birth that really spurred me to start Labor Nurse Mama. And I gave her as much information as I could, but ultimately she felt more peace going to the OR instead of, because it really is like when you have a lack of peace in your labor room, the effect is going to be the same no matter where it's coming from. And so that was really hard for me as a labor nurse as well. But again, it's about what they want, period. So I love that you said that, because I think we all have the disruptive doctor, the peaceful doctor, disruptive nurse, the disruptive doula. And it really is about what you said, like ultimately what she wants. And like I told you, my births were not picture perfect. So I always tell my students that I can't guarantee a perfect birth, but I can guarantee that you're going to know what's happening inside you, around you, and you will know how to ask the right questions. That I can guarantee. And that You can have a birth that on the outside, people are like, oh my God, I can't believe that happened. But you leave feeling really empowered and that it was your birth and you loved it.
Yeah, and you chose all the pieces to it, right? It really is about who is in control of that room. And I think one of the things I love about you so much is that you talk about doctors love to be in control. The hospital system was designed to be in control. And I think, what you and I really are just pushing people to do, women to do, is you be in control. I want you making the decisions. Don't let the hospital make decisions for you. Don't decline stuff just because you can, but don't let them make decisions for you. You be the decision maker in your birth, and that is how you are going to have your best birth possible. And your best birth is different than her best birth, and it's different than mine, and it's different than theirs, and it's different than your neighbors and your sisters and your cousins and your best friends. Your birth is as individual as your fingerprint, and that's why the decisions that are made during that time also have to be individualized by you and by your care team. It's very, very important.
And I always joke around and say it's like a wedding, right? You would never let everyone else make all the decisions of your wedding. You might end up in like all the bridesmaids have like purple and pink dresses and and there's all these things and you would be seeing all the things that are wrong. However, if you make all the decisions, even if some things go wrong, you go with it, you pivot, and that's how your birth should be. You should be the one that is driving it. And that goes down to, like we talked about before, if there's someone in your room, I don't care who it is, if they are causing dissension, they need to be talked to. And you can fire your nurse, you can fire your doctor, you can fire your doula. Your partner might not. It might be a little difficult with the partner situation, but I have seen that go south sometimes during a delivery. But you definitely need to remember that this only happens once for you. Even if you have 7 kids like me, that birth with that baby, it's one time. And it's a job for the rest of us. No matter how much we love it, it's still a job. It is not going to affect the rest of our lives, but it does affect yours. And if it's that big of a deal for you, then you should be the one. Don't wing it. Don't just be like, oh, I'll show up. They'll do what I'm going to get my epidural. I always say no, do not just show up because that will lead to trauma.
Yeah. Winging it is tough. I've seen people go into birth and actually wing it and have an amazing birth. One of my closest friends, I'm a doula. I've been a doula for years. This is her second baby. And I am like, please don't wing this. Don't wing this. And she's like, I winged it. I wung it the first time. It turned out fine. And I'm like, okay, that was luck. Please don't play with fire. Now we're asking, like, you got away with it once. Don't do it again. She did it again and she had another fabulous birth. So some people can do that. I think it's some people's personalities. That's not normal.
That's also a luck. Because if the pieces are good, you have a good doctor, you have a good nurse, and the unit's not busy and everybody's doting on you, yeah, you might be able to wing it because maybe your nurse has more time to show you some positions and do these different things with you. Or, but even having a really fast birth can be traumatizing if you don't know what the heck's happening to you. So do you really want to chance it that you'll be the one of how many who have birth trauma that just loved their birth that they were winging? The majority of my parents who come to me who've already had a baby are coming to me because that wing it don't work.
Yeah,
it doesn't work.
That's so true. That is so true. Oh my gosh.
So I would say she's rare.
No, definitely. She's a unicorn. And I think, that's all that to say, like, does it happen? Sure, it totally can. That's not the norm. So if you're banking on that, I personally, no offense, would have a plan B. I would have a backup plan because if that's your plan A, what are you going to do if plan A doesn't work out? I'm encouraging you to have a little bit of education in your back pocket because winging it, you're right. It can work.
It's a chance.
But it doesn't. Yeah, it doesn't often. I have something that just like dropped into my head. Can I give some tips for how doulas can go into the hospital and like start to facilitate a good relationship? Like, how can they put in positively to the birth room and work together with the hospital
Yes,
staff? Because
please.
I
I
feel
love
like
it.
this is really something that I'm super, super good at. So the first thing that I always do is introduce myself to the nurse. So if this is a nurse that comes and gets you from the waiting room, when they come to get you, you should say, "Are you our nurse?" And a lot of times it is. And you can say, "Hey, I'm HeHe. I'm super excited to be here. I've been a doula for X amount of years." So just let them know. If you're new, they're not going to judge you. Just let them know. If you've been a doula for 50 years, they're not going to judge you. Just let them know who you are, a little bit about what your goals are. And this is quick, you guys. It's while you're walking from the lobby or the waiting area to the room where your clients are. By the time you get to that door, you're done with that conversation. It's not an ongoing conversation, but you've introduced yourself. You've told them that you're excited to be there and you're excited to work together. And this is one of my little like secret weapons. Offer to be helpful and say, "I am not here to get in the way. So if I'm ever in the way, please let me know. But also, you should know I'm here to be extra hands for you. I know that you don't have enough hands to get everything done. So if there's anything that I can do to help make your job easier, please don't hesitate to ask me." Again, my name is HeHe, but you can really call me anything. I answer to a lot. Okay. Now we've let that nurse know, "Hey, I'm safe. I'm on your team. We're working together. I'm not going to try and make this some sort of funky space where it's us versus you. I promise." Okay. Then you go into the room, wash your hands, set your stuff down, say hi to your clients, and then really just be. Don't try to be making decisions for people. Don't try to be interfering. Don't try to be reading the monitors. Don't try to be rearranging the room. Now, I understand setting things like little candles out, keeping the lights dim. One of the things that you can do is if you're going to be changing things in the room, just let your medical staff know why you're doing it. "Hey, Trish, I'm going to be turning down these lights because Megan really wants to birth in a dark place and she just told me that the lights are a little bright. Is that okay with you?" Cool. The nurse is never going to be like, "No, keep the bright lights on." And I guess if they did, you could just be like, "Okay, well, Megan wants them off, so we're going to turn them off for now. And maybe if we need them later, we can turn them on, if we need them." It's okay for you to set
Or
boundaries.
the nurse might say, "Hey, I'm getting ready to start her IV or do this, and I need the lights up, but
Totally.
as soon as we're done, that would be fine."
Totally. Another compromise there is, would you mind if I turn these big overhead lights on and I actually just brought the flashlight on my phone over, or I actually have this headlamp in my birth bag. Could I just like hold that over? Like
Do
there's
you
so many
really? Do you
compromises.
really have a headlamp in your birth
So
bag?
sometimes, yeah. So I've had clients who absolutely do not want any lights on. And so then that big, huge light that
I call
actually
them
is
the
a
lights of
lot
God.
brighter. I mean, it is just like, it is like,
That's
"Oh, the
exactly what
heavens have just opened
I'm like,
up."
I'm about to turn the lights of God on your vagina. Just giving you a heads up.
Seriously. Yeah. That doesn't fit well with a lot of people. I mean, sometimes people just find that super disruptive. You can have a headlamp and just hand it to the doctor, and it will literally keep it contained right there to their vaginal area. It takes a really open doctor
Yeah, I've
that's
never
receptive to
seen
that
this
kind of
in
stuff.
16 years. That's why I'm asking.
Yeah. I mean, look, the, at some point you're going to come across a client or a patient that just is not flexible and they're not going to do it. And so you will either compromise to what they want or you just will go without. And so I have had clients who say, you will not turn that light on. And so then
And more power to her, because birth can have here's something I want you guys to hear. This is really, really shocking, cutting edge. But your baby can come out without that
you
light.
don't say.
It can happen. It can actually happen. And I always am like, for those of you who haven't had a baby, you're pregnant, one of the most beautiful things in the world is when the doctor's out of the room and I'm able to dim the lights back and that baby's eyes just pop open. They don't want those damn bright lights either. It's awful. And remember what I told you, one of our mantras inside of my world is nothing out of convenience or curiosity. That light is convenient for someone. It is not your vagina or your baby or you, it's the doctor. so they can see the playing field. But birth can happen without them being able to see every little nook and cranny. So, I mean, even in that sense, they don't need that headlight either. It can happen. Now, if something happens that's emergent, and that's different. And again, it goes back to, like we talked about, reading the room. If your you can tell if it's an emergency or it's a convenience.
Yeah. I mean, I think too, there's something to be said about just being in control of the environment, because we know what that does to our hormones. So if someone is constantly flicking on and off and on and off and on a light, it's going to disrupt her hormones. I mean, just think about it, and then we wonder, well, why is her contractions slowed, and why have her contractions spaced out, and why are these not as intense? Well, it's because the environment that she's trying to birth in, and she's feeling this tug of war with her provider that they have to have it their way. But then for a fact that's not an evidence-based decision, or that mom knows for a fact that she doesn't want those lights on, or better yet, she knows for a fact she don't want to birth on her back, and that doctor just will not give up. They're relentless. You got to get on your back. You got to get on your back. I can't do it this way. I can't see your baby. I definitely cannot deliver your baby this way. And it's like, of course that's going to disrupt your labor. It's literally shutting off the chemicals in your brain that you need to birth, Okay, so introduce yourself, offer to make their job easier. And then my favorite way to actually kind of progress the room and get people on board is asking open-ended questions. So this may look like me saying, hey, Megan, so my client, do you have any questions for Trish about the IVs she's going to set? Do you have any questions about the doctor that's on call? Do you have any questions about having your waters ruptured and what that may mean for your labor later down the road, right? And so I think a lot of doulas are unsure how to speak up in the room. And for me, questions are just a little secret weapon. It is just asking open-ended questions. They aren't suggestive of anything. So you're not, be careful of your tone and be very mindful of the inflection. So you're not saying, Trish, do you have any questions for your doctor about the risk of a amniotomy? It's not sassy. It's not inflammatory. It's just open-ended questions. Do you have any questions about what this procedure might look like? You have any questions about what the fetal scalp electrode looks like or how it's placed on your baby's head? There's nothing that you're not trying to rile up the room. Remember, your job.
That was a heavy one, though. Because most of them don't know how it's placed on their head.
And a lot of doctors are not upfront about it. It's a clip.
No.
It's a sticker. Oh, we just place it. No, it's a little baby tiny corkscrew. We screw that into your baby's head, which sometimes is needed. You don't want to demonize that either, right? We're not trying to demonize any option, but it's very important that you understand what's happening.
It's needed when it's needed, not out of convenience or curiosity.
Oh my God.
I say this to my students too. Like I do a free workshop where I go through a lot of this, and when your baby, like, you can say, I absolutely would never do an FSC, or I'd never do a vacuum, or any of those things. But if your baby is down in the 40s and we cannot resuscitate that baby, and we need to know what's going on so we can make a decision to save you and this baby, you're going to say yes. Like, you should say yes. There is a reason. And thank God for technology. Thank God we have FSCs and we have C-sections and we have all those things, because there would be a lot of people who wouldn't be with us. But on the flip side, it is not needed if maybe mom is fluffy and the nurse can't keep the monitor on her. They don't need to go and screw it into the baby's head. Like, that just means the nurse needs to work harder. Maybe she needs to come in every 15 minutes to adjust the monitor. But we should not be using something that's for a specific set of circumstances just because someone is inconvenienced by it. And that's where I get really fired up.
Yeah. I always remind people that, the tools that we have were made out of necessity. Most of the time they were made because we saw a gap in care and we created a tool to make that better. However, what we have done, especially in the US, but birth in general, is we have overutilized almost everything. There is almost nothing in the birth world, right down to cervical checks, that we don't utilize properly. I mean, it is like, or that we do utilize properly. Almost everything is overutilized, and it is just inserted into birth in places where it's just not needed or appropriate.
Yeah, I love that you brought up the cervical checks because I was a guest
Oh,
on
yeah.
evidence-based birth, and I had a team meeting right after that, and my team and my students all know me, but one of the questions was, what would you tell a student who is going to the hospital, she's in labor, and they tell her they won't admit her if she won't let them do a cervical exam? And I was like, how would you tell her to answer? Like, what would you say to tell her? I said, say no. No, they have to. And I was like, here's the truth. They have to admit her. And she said, you would just tell her to say no. And I was like, yes, no is enough. Like, you can say no. And again, just like the lights, birth can actually happen without a cervical exam. Now, if you're being induced, you've agreed to being induced. We do have to do them, not as much as, like, some hospitals still do them every 2 hours. Like, it's ridiculous. We don't have to do them that much, but to be able to titrate the medicine and change, like, decide your plan of care, we have to know what's happening. And a lot of times it's not your body language. Like, a good nurse can diagnose how far dilated you are when you come through the doors if you're in labor, but induction's a little different. So we do need to know in that case. But other than that, one of my favorite stories with a student, I had this student, HeHe. So if HeHe's listening, you're a badass. HeHe came to me to my Fearless Birth experience, which is like a 5-day birth challenge experience. And at the start of it, she came wanting a scheduled C-section. I flipped her mindset. I have a very set way of flipping mindsets. And she decides not only did she not want a C-section, she wanted unmedicated. She was never going to have a cervical exam during pregnancy. She was going to wait for labor to start. So her doctor was just blown away by her, because she kept refusing the cervical exams. And she was like, no, they don't mean anything, right? Like, what does it matter if I'm dilated right now? And what does it matter if I'm not? Like, it doesn't matter. I'm waiting for labor to start. So her very first, she did end up going almost to 42 weeks and did get induced. So she goes in and they do her very first cervical exam and she's not dilated. Like, barely. And she was like, see? Like, what? You wanted to check me at 37 weeks. Like, why would it have mattered? And so she had a beautiful birth. And obviously, like, she ended up getting induced because she was like 41 in 4 days or something, I believe, something like that. And I could be getting that a little bit, but I do know her first cervical exam was in the hospital. And she looked at me, she goes, that's why it didn't matter. She could have every week had a cervical exam, and that would have led to more innuendos and suggestions. So I always tell them, unless they want it, if they want it, that's different. If they want the cervical exam, that's fine. But yeah, they're not necessary. But okay, so what you recommend is polite communication skills.
Yeah, I mean, and just direct,
like, get to know her.
Totally.
Yeah.
And I think it can definitely, depending on the culture of the hospital that you're walking into, it can feel like you're not welcome as a doula. I have attended births all over the nation. I do travel doula support. And so I've been really, really blessed at being able to see a lot of hospital cultures. And sometimes we are welcomed with open arms and people love to have us there. And nurses are like, yes, a doula, I love it. And the physicians and the midwives are like, yes, a doula, I love it. And then there are some hospitals that you walk into and they're like, and you are who? And why are you here? Why does she need a doula? I've literally been looked in the eyeballs and asked, why does she need a doula? And the mom was sitting right there and she was like, well, because I wanted the extra support and I wanted to make sure that I had somebody with me to help me make decisions. And the nurse just rolled her eyes like she could not even believe that a doula was here. And so you are gonna walk into different scenarios. You have to be in control of you. You have to remember that no matter what that hospital culture is, doesn't have anything to do with you as a doula. Your job is to make sure that mom is respected, she is heard and listened to, and that she is the one making decisions, right? She's not being taken advantage of. People are not bullying her. She's not being coerced into decisions without a discussion or without information that she needs that's critical to that decision. That is your job. Your job is not to fight with hospital staff. Your job is not to fix the hospital culture. Your job is not to insert yourself into anything. You are there as I almost think about it as like the Wharton's jelly. We are there to make sure that things are smooth. And if there's a knot, fine. We will make sure that it never gets too tense and too tight, that it causes some sort of compromise for that birth situation. We are the jelly that keeps things moving and grooving, whatever.
Do you want to explain what Wharton's jelly is for my mamas who are listening?
Absolutely. So on your umbilical cord, it is the coolest thing. Your body naturally lubricates it with Wharton's jelly, and it keeps the cord from being compressed, and it keeps the cord from drying out. It just keeps it really healthy so that the blood and oxygen can continue to flow through that. But sometimes the umbilical cord can get a knot in it, and it is where your baby has kind of flipped through. So it looks like a physical knot, as if you were to tie like a shoelace in a knot, except it's in your umbilical cord. Now, that can cause problems if it gets too tight, or if it starts to squeeze the umbilical cord too much. It may compromise your baby. But Wharton's jelly, its literal job is to keep that knot sliding back and forth. And so if you look up videos online, you can see nurses and doctors holding the knot and sliding it. You guys, it is the coolest thing ever. It is so neat. And I think for me, it just, like I say, it's just a really cool analogy to think about doulas as that jelly, that there may be knots that were totally out of our control. We didn't cause them and we can't undo them, but what we can do is make sure that they don't compromise that birth experience and we keep things moving and grooving and smooth.
But don't you think all of us should be that though?
Yes, but that goes back to you can't control other people. I can't control,
Yeah. No, but I'm saying if the doctors were viewing it that way, if the nurses are viewing it the way, if the partners were viewing it that way, all of it, it would just be we're all working together to have this beautiful birth experience. Well, thank you so much for coming today. Can you tell everyone where they can find you?
Yeah, absolutely. Thanks for having me. This really was a joy. People can find me at thebirthlounge.com, and you'll find all of my stuff there. You can download the Birth Lounge app. It's $5 a month, and it gives you all evidence-based articles that will help you have discussion with your providers. There's questions to ask your providers and data and science and everything. And yeah, find me on Instagram. I'm Tranquility by HeHe and the.birth.lounge, and we hang out, and it's just a lot of fun, birth nerdy stuff, education, and talking about the what ifs and talking about, how do I do this? How do I say that? Where do I find this information? So yeah, check it out.
I love it.
Oh, thank you.
We turn what ifs into even ifs. That's our theory over here so that you can navigate it. All right. Well, thank you so much. Wow. What a conversation. I loved this episode, and I hope you guys are walking away, whether you're a doula or a pregnant mama, I hope you're walking away with a better understanding of the doula's role as an advocate and how creating a collaborative relationship with everyone inside of your birth team is so stinking important. If you love this episode, don't forget to share it with someone who might need the message. Check out HeHe at the Birth Lounge. Make sure you guys hit subscribe and leave a review. We're going to do a drawing at the end of the month. Thank you so much. I'll see you guys again next Friday. Bye for now.